Hi, Doc. Good afternoon.
Afternoon. Afternoon, Pod.
Okay, so good afternoon also to everyone. I'm Audrey, and we're back for another Ask Your Asian Eye Doctor Facebook Live Q&A. So February, in case you didn't know, it's Age-related Macular Degeneration Month. So today, we've invited Dr. Patricia Quilendrino to help us understand how this condition affects your vision and answer questions about whether it can actually turn into blindness, and then who is it that can be treated, and what we can do to kind of avoid developing this condition or have it get worse. So join us till the end, and if you have any questions, go ahead and leave us a comment. Sasagutin namin yan matapos ang aming discussion. But before we start, let me first introduce Dr. Quilendrino. So Dr. Quilendrino specializes in retina and vitreous disease, as well as cataract and comprehensive ophthalmology. She completed her medicine degree at the University of the East Ramon Magsaysay Memorial Medical Center, and she obtained her medical internship residency training in ophthalmology, as well as her medical and surgical fellowship in retina and vitreous disease at the University of the Philippines, PGH, the Philippine General Hospital. So she's also a diplomate of the Philippine Board of Ophthalmology, and she's given various presentations at different conferences, both locally and internationally. Aside from that, she's a teaching consultant at the Quezon City General Hospital, and she's a Retina Fellowship Training Officer at Asian Eye Institute. So, Doc, that's actually, you've done quite a lot of things when it comes to retinal conditions, retinal diseases. But I think the thing that's challenging is that ano pa ka talaga tong age-related macular degeneration? It sounds so complicated. What part of the eye does it affect?
Yes. Good afternoon to everyone. Good afternoon, Audrey. So it's nice to discuss AMD or age-related macular degeneration today. So as you said, what is AMD? Age-related macular degeneration. It means it is age-related. It is something na mas lumalabas sa pag-iedad ng mata, with advancing age. Usually we see it at 60s and above. And macular degeneration, humihina yung macula. So yung humihina yung macula, the macula is the part of the retina responsible for central vision. So in essence, humihina yung macula, humihina yung central vision natin. So like in the photo here, you could see, na it's in the back part of the eye. The one in the picture is shown is the retina, and nasa gitna niya yung macula. And in this area, meron siyang yellow deposits, kaya masasabi natin na may ongoing damage sa macula. Probably may AMD na rin ito sa photo nito.
Okay. So it's interesting daw kasi for most people, when you say it's a part of the eye, parang, di ba, there are different parts to it pala. You assume, sige, meron lang yung harap, tapos sige yung likod. You don't realize na the space in between pwede rin pala magka-problema.
Yes.
So siguro related to that, why does it deteriorate? What happens to the macula?
Sige, so why the macula deteriorates? I guess we can say like, as with any body part, habang tumatagal, pwedeng hihina talaga. Parang yung knees natin, hihina pag maglalakad, pag mas matanda na, yung hearing natin. So ito mga expected age-related changes to. And the eye is not exempt from aging. However, minsan mas malubha ang nagiging sakit. Kaya nagkakaroon tayo ng macular degeneration. At nasisira talaga yung central vision natin. And this is not caused by watching too much TV or with the food that we eat or with baka too much activity. Hindi naman siya ganun. So, bakit siya nag-deteriorate, So, minsan nagkakaroon, dalawang ways nagkakaroon ng macular degeneration. We have the dry type and the wet type. So, yung dry type, ito yung nagkakaroon ng yellow deposits. Nagkakaroon ng yellow deposits sa macula natin. Normally, natatanggal yan, pero kapag humihina yung mata, naiiwan itong yellow deposits na to. So, ang nangyayari, because of the yellow deposits, numinipis yung macula natin and it becomes weaker. However, the other type naman is called wet macular degeneration. So, ang difference naman ng wet type is meron naman tayong abnormal blood vessels na tumutubo. So, these abnormal blood vessels, hindi sila yung magandang type na blood vessels. Sila yung pwedeng mag-leak, sila yung pwedeng mag-bleed. And pag nagkaroon ng leakage sa pag-bleeding, ito yung nagkakos ng sudden changes in vision. So this is the wet type of macular degeneration.
Okay, Doc. And then you talked about aging kasi. At what age ba nagde-develop ng AMD? At sino ba yung talagang likely magka-develop nito?
Yes. So, since age-related siya, we usually see it sa age 60 and above, no? And as you grow older, the chances of having AMD becomes higher. So, also, there are also some patients who are more prone to develop macular degeneration. They have, pwedeng yung mga merong family history. It could be that the parents or the lola had macular degeneration. Of Caucasian descent, smoking, no? If you have been smoking for a long time, wala kang nararamdaman, there's a high risk, no, that your vision will be damaged because of the history of smoking. If you are obese, may some studies sinasabi that if your BMI is 30 and above, no, mas dodoble yung chance mo na magkaroon ka ng AMD. Kapag high blood or pag may hypertension, no, because it can affect how oxygen gets into the eyes. And also for women, sabi nila, women are more prone to develop AMD kasi women tend to live longer. So, yun yung mga known na risk factors, so, aside from age.
So, Doc, when you say na yung hypertension and obesity have an effect, in general kasi the idea is that kapag mas mataas ang timbang mo or medyo mataas ang blood pressure mo, yung iniisip ng mga tao that, oh, okay, hindi lang siya as healthy. But you're pointing out that those things actually can affect your eyes and it can turn into this particular condition.
Yes, that's right, Audrey. No? So, aside from the other known effects of hypertension and obesity, pwede rin ma-damage ang mata from these conditions. So, kasama yun sa babantayan natin.
Okay. And then, Doc, how does a person know na meron na pala siya nitong AMD? Are there signs that you'll find at the start, or is it really a doctor that can figure out that you have this condition na?
Yes. So, it depends on what type of AMD you have and what stage natin siya makikita. Most of the time, you may have blurry vision. It may start out as blurry vision lang, pwede non-specific, no? Tapos dahan-dahan lumalabo. Pero ang particular sa macular degeneration is, ang nasisira dito is the central vision, no? So if we divide the visual field, no, it will be central and peripheral. Ang masasira is the center. So if tumingin ka sa diretsyo, parang yung mukha, baka hindi mo masyado makita o magkakaroon na ng distortion or magkakaroon na ng central spot, yun yung tinatawag namin scotoma, baka may gray or black spot in the center na hindi nawawala. Nandun lang siya, pirmi lang siya. Pagkatapos, pwede rin mapansin na magkakaroon ng decrease in brightness and intensity of colors. And, yung distortion naman, some patients would complain na parang wavy or maalon yung paningin. And it's just in the center, no? Kung mapapansin nila yung peripheral vision remains okay.
And then, Doc, what happens if it isn't detected early?
There's a chance na maging irreversible yung vision loss, no? Kasi kapag maaga pa, pwede nating maagapan. It depends on what type, no? And usually we give injections, and this will help to improve your vision and to make the disease quiet, no? So yun ang kadalasang advantage if it detected early.
Interesting, Doc, when you mentioned kasi na you make a disease quiet. So, the idea being, kapag merong nangyayari sa loob ng mata mo, hindi mo siya necessary nakikita from the outside. All you can see is that parang blurry yung vision ko, parang meron akong spots na nakikita. But it's not as if your eyes are particularly red or yung sinasabi mong yellow deposits are seen from the outside.
Yes, that's right. No, that's very good point that you raised, no, Audrey, kasi itong macular degeneration, it's not something that you will notice pag tumingin ka sa mirror or pag nakita to ng asawa mo or ng anak mo, no? Nasa likod kasi siya, and hindi ito yung makikita lang ito kapag nag-undergo ka ng comprehensive eye exam, sa retina checks, no? If you undergo that.
And siguro, Doc, yung interesting kasi is that you say that it affects central vision. So, hindi siya yung basta-basta, hindi ko napansin itong sa side ko, yung may nasagi ako, bigla.
Yes.
It's actually exactly where you're looking every day. So let's say nagluluto ka, ang mangyayari nun, parang malabo 'tong tinitingnan ko, hindi ako makahiwa ng maayos.
Yes,
For
that's right.
example,
That's right.
nagtatahi, like, no, important, it's a pretty important, part of your vision. It will definitely affect your daily life. And
Yes.
though, just because it affects my central vision, does that mean na, kapag nagpagamat ako mawawala ito, or let's say puwede ba akong mabubulag with this particular condition?
Yes. Kung pagkabulag kasi, we define is talagang wala ng ilaw na naaaninag eh. No light perception. No? So, hindi naman ganun ang case kapag macular degeneration. If you are not able to catch it early, no, ang advanced stage ng macular degeneration, sira talaga yung central vision. Kapag papabasahin ka, baka wala kang mabasang letra, or baka nakakabilang ka lang, ganun. But yung peripheral vision mo is intact. Maliwanag yung gilid, no? So, that's why it's not complete blindness, no? But there is severe impairment of the central vision.
Okay. And then Doc, kapag nagkaroon ka nitong pagkabulag or a visual impairment due to AMD, is it permanent?
Pag nagkaroon ka ng AMD, it's not a condition na mawawala siya if you have treatment, no? So, wala kasi talaga siyang complete cure because this is also age-related. Hindi naman lahat bumabata. Natural naman yun that will go to advanced age. But we can minimize the damage of macular degeneration, and we can prevent severe worsening and progression na makaka-impair sa daily activities mo. That is with proper treatment and early detection and monitoring.
And then Doc, you said depende sa klase ng AMD yung kind of treatment that you're recommended, and one of those things is yung injections.
That's
So
right.
what other kinds of treatment are possible kapag na-diagnose ka with AMD?
Alright, so ang kadalasang treatments, yung ano, as you mentioned, with the eye injections, no? Ang general name for the medicine is anti-VEGF, no? So these are given monthly until tumahimik yung condition sa mata. Some cases, we would also employ laser. Actually, ito yung unang way of treating macular degeneration. But nagkaroon na rin ng with advanced improvements, no? Over time, na-replace na yung laser by the injections. Mas first line na natin yung anti-VEGF injections. Aside from treatments that you can give to the eye, it's important also to recognize and to give treatment also to the patient per se, no, who is impaired with vision. So that means dito papasok yung low vision rehabilitation. No? So it would be any treatment or management that to help them adjust, no, to this type of vision. Kasi hindi naman sila bulag eh, and we would want to help them adapt to this vision impairment.
Okay. Doc, when you're talking about adaptation, kasi if your central vision is the one that's affected, yung mga pasyente bang may AMD, sila yung tipong kapag nakatingin sila dapat diretso sa inyo, they'll actually tilt their face a little bit para makita ka na mas malinaw.
Yes, you're right. Oo. So, minsan, parang medyo ganyan. Medyo may konting lihis for them to see well. No? So, that's correct. That is one of the ways patients with macular degeneration adjust to their condition.
Okay, so siguro that's something to keep in mind if you're talking to someone who's a little bit older and you notice na kapag tinitilt nila ng konti yung expression, it's not that they don't wanna look at you. Pag minsan, it's a coping mechanism to allow them to see you clearly.
Yes, that's right.
And then, Doc, let's say nag-start na ako ng treatment for AMD. Does this means I have to keep going back to you maybe on a year-on-year basis to manage this condition?
Yes, no. Once diagnosed, the condition will require regular checkups because, especially the comprehensive eye exams. No? Kasi we will have to monitor the condition, we have to check if there's progression, and we have to give treatments, no, as early as possible once ma-detect natin na nagkaroon ng progression. Yun. So, kailangan na talaga ng regular checkups kapag na-diagnose.
And siguro the thing to point out is that during this pandemic, for a lot of the doctors, kasi in depending on the kind of condition that you treat, in particular, kapag retina doctor ka, it's very difficult to stop any sort of treatment precisely because it's something na pwedeng mag-progress kapag hindi siya nabantayan. So in your case, Doc, correct me if I'm wrong, but you ended up continuing to see patients as needed, especially for those that really needed to get checked regularly.
That's right. Oo. So, that's why it was challenging ng pandemic, no? Kasi there were a lot of patients who were receiving treatment, and then because of the pandemic, it's no one's fault naman. Ganun lang talaga. We were not able to see them and monitor them. And yung iba, the improvements that we got, parang na-stall kami, or some deteriorate pa yung vision ng konti because they were not able to receive the timed treatments. Pero nung nakabalik naman, nakahabol naman din.
So that's good. So at least if you're a patient at nabigyan ka ng diagnosis na ganito, it's important that you go back to your doctor. You find out. Kasi as much as gusto nating i-deny na, ay parang okay pa yung vision ko. It's worse kasi kung hihintayin mo until meron ng actual impact on your vision. So Doc, let's say isa akong patient na initially diagnosed with dry AMD. Pwede ba ako maging wet AMD afterwards? Let's say hindi ako nagpagpa-check up sa inyo for a while.
Yes, there is a chance, no? Like 1/3 of patients with dry AMD convert to the wet AMD. Ang difference kasi ng dry AMD, minsan pag nasilip naman yung pasyente, maganda pa yung vision yung iba. Most of the time when we diagnose it, no? Maganda pa yung vision. Tapos ang behavior nito, dahan-dahan lang lalabo yung mata. Pero ang isang sign na nag-convert na there would be sudden blurring of vision, no? Or biglang merong black spot na makikita na parang hindi matanggal, talagang nasa gitna lang siya. Or nagiging wavy, yun nga, no, as you mentioned natin, kung nagiging wavy yung paningin. So yun yung possibility na from dry type, baka nag-convert na siya to the wet type.
Okay. Yun, so siguro Doc, when it comes to let's say wet AMD na, kapag hindi siya na-treat agad, does that mean that there's such a thing as scarring that can happen? Tama ba yun, Doc?
That's right. Oo. So, ang mahirap talaga sa wet AMD is there is scarring. Pwede talagang magkaroon ng scar, no? And the treatments may help to minimize the damage of the scarring. So, kung hindi tayo magagamot, malaki yung possibility, magiging malaki yung peklat, no? Or yung scar. And ang mahirap kasi ngayon, ang scar, wala tayong gamot for scars, no? And pag nagkaroon na ng scar, magkakos na yun ng permanent change sa vision, permanent blurring of vision.
I see. And then docs, once it's developing naman in you, let's say you have no idea or you have not gotten your eyes checked at all in the past couple of months or the past 2 years due to the pandemic. And ang AMD in particular, wala kasi siyang symptoms. So how would I know na, alam mo, baka at risk ako, baka dapat kailangan ko na magpa-check up sa doctor?
It's siguro ang magandang starting point is kapag 60 and above, you really have to come in for checkup, no? And it's not just a checkup na vision check lang, no? Parang checkup lang sa salamin. That's not enough. That will not detect AMD. Very important ang comprehensive eye examinations kasi dito may examine from the front to the back part of the eye. Makikita natin kung alin yung mga parts na nagkakaroon ng damage o ano yung babantayan, and we can give timely treatment to prevent worsening.
And then, Doc, when you're talking about a comprehensive eye exam, dun rin nakikita whether it's not pala AMD that's affecting your eyes, but also other lifestyle conditions that might be causing changes in your vision. So let's say, makikita rin ba sa mata kung yun pala medyo mataas ang sugar mo or hypertensive ka?
Yes, that's right. No? So, kasama sa comprehensive eye check, kasi hindi lang naman retina yung ini-examine natin. So, we examine from the front part. So, kung from the front part, makikita kung may problem sa cornea, yung lente, kung may cataract na, yung pressure, baka at risk na rin for glaucoma. Yun yung mga common conditions kasi nakikita namin. No? And of course, no, yun nga, yung examination sa retina, aside from AMD, pwede magkaroon ng complications from diabetes and hypertension. And pwede rin magkaroon ng retinal detachment. So, kasama yun sa kasama yun sa ini-examine natin when we do a comprehensive eye exam.
And then, Doc, kailangan ba i-dilate ang mata ng isang pasyente? Kunyari, magpapa-comprehensive eye exam siya.
Pag mayroong concern na baka retina yung cause or baka may na-determine yung doctor na baka meron siyang problem sa retina like for diabetics, no, or for yun nga, mga 60s and above, no? Kasi babantayan na namin yan kung may macular degeneration. we would probably do a retina check, which will involve dilation, no? Yun yung tinatawag na dilation. Papatakan namin ng gamot yung mata. Ang nangyayari is yung pupil size, from this size, medyo lalaki siya ng konti. So, we can see better para mas makita namin yung mabuti.
Okay. And then what are some of the tests, Doc, that you actually conduct as part of the comprehensive eye exam?
So, yung vision check, that's one.
Mm-hmm.
Tapos, we use microscope, no, para ma-examine yung different parts of the eye. That's the slit lamp microscope. Tapos, if we see na merong mga sakit, we may have to do more tests, no? Like for macular degeneration, nagre-request kami kadalasan ng fluorescent angiogram. So, angiogram, kagaya siya nung angiogram sa puso, di ba? Yun ang mas common na alam natin. No? So, ganun din yung principle. Mag-i-inject tayo ng dye, no? Tapos, pagka-inject ng dye, pupunta yan sa mata, and then we will take photos, no? It's a good examination to check the circulation, lalo na kung nagko-consider tayo ng wet macular degeneration. And also, we do the OCT, no? Ocular Coherence Tomography. Ang kinagandahan naman nun, we can take different images of the retina. No? So parang we're able to check the different layers of the retina. No? Para na-identify natin kung merong bleeding or swelling.
Mm-hmm. So, the way it sounds like a very serious condition talaga itong AMD. So what are some of the good ways that I can, what are the good things that I can do to protect my vision?
Yes, so it does not have, you do not have to wait until you're old to protect, no? There are different ways that you can help protect your eyes as early as now, no? So you can change your lifestyle. Hindi lang mata mo magbe-benefit dito eh. Overall health, no? If you eat healthy, ang recommendation namin kapag sa food, try to make it as colorful as possible, no? So you get the necessary eye vitamins. You quit smoking. If you smoke, you include exercise, and you have to manage your blood sugar and your high blood pressure if you're diabetic and hypertensive. And of course, do not forget to get your comprehensive eye exams kasi even if wala kang nararamdaman, it's good na wala kang nararamdaman, walang blurring, walang masakit. Pero if you have the risk factors, you may be developing something already. And mahirap kapag may nararamdaman ka na kasi baka advice nila.
And then, Doc, how often should a person get checked?
For pag 60s and above, we recommend a checkup kahit every 6 months. Mm-hmm. Kapag meron ng findings sa macular degeneration, pwedeng every 3 to 6 months yung examination. Pero kung wet AMD yan, we may have to ask them to come monthly to receive treatments. No? Tapos kapag nagsastabilize na yung condition, pwedeng mas matagal na yung interval, every 2 or 3 months to receive treatment and to monitor the disease.
Mm-hmm. Doc, you were mentioning that a healthy lifestyle and eating a balanced diet is important. For people that are worried na baka hindi nila na-achieve yon, yung maayos na diet, is it advisable to take supplements or eye vitamins, whether or not you have AMD?
That's a very common question. I receive that from my patients din, no? Kasi they want to take care of their eyes. Doc, mag-vitamins na ba ako? Ganyan, no? So, sa ngayon, the studies, no, and the recommendations, ang recommendations is you take the eye supplements if you are diagnosed with moderate to severe AMD. Pero I always mention this to patients. And if the patients opt to take it, okay lang, no? Sabi ko naman sa kanila, the eye vitamins, they are antioxidants and they can improve overall health. But taking the vitamins will not decrease the chances that they will develop AMD in the future. But you can take it for overall health.
Okay. And then, Doc, ngayon na meron pa rin kasing COVID-19, right? Although the cases are down, it's still worrisome for a lot of people na magpa-check up. Is Asian Eye Tele or teleconsultation service an option for patients with AMD?
Teleconsultation is an option for patients who may have other eye conditions. Siguro like if you have a concern about eye redness, dryness, no? Or parang baka merong, usually sa mas external eye condition, teleconsultation will be able to help you with those concerns. Ang mahirap kasi sa AMD, it's in the back part of the eye, no? And limited tayo by the technology of teleconsultation. So for concerns about AMD, it's still best to come in for consult.
Okay. And then, Doc, siguro, a lot of these things are very interesting. So, those are the things to remember. One is that if you have a loved one that's like 60 years old and older, it's better that they get checked, right? The minimum is yearly, but it's much better if it's every 6 months. And that also, as much as we want to do teleconsultation, wala pa ring replacement. There is nothing that matches the comprehensiveness of being able to come in for a checkup. And
That,
then, Doc, we do actually have a couple of viewers with some questions for you. So the first one is, tell us more about epiretinal membrane. How serious is it, and what's the prognosis?
okay, epiretinal membrane is the formation of a membrane. No, it's I describe it to the patient. It's like a clear plastic, no, that grows above the retina. So iba-iba kasi ang membranes eh. There are membranes that are flat lang. They do not, hindi nila nakukulubot yung retina underneath. So if it's just flat and lying there, the patient has good vision. We don't touch it. But
Mhm.
if the membrane causes kulubot, no, sorry, nakukulubot na yung retina, no, and nagiging kulubot din yung vision, nagkakaroon ng distortion, dumalabo yung mata, that would require surgery to remove the membrane. So
Okay.
it will depend. It will depend on what type of membrane you have.
Okay, so it could be a matter of let's not touch it because it's not affecting your vision, or we have to do something about it because it looks like it could siguro effectively squish your retina kapag nagkakaroon siya ng kulubot.
Yes, that's right. So ang important sa may epiretinal membranes, you really have to come regularly for checkups because that is the only way we will monitor if nagkakaroon talaga ng worsening or not.
And ito naman, Doc, the next question is, I am now suffering from some subconjunctival hemorrhage. Does it have anything to do with my AMD?
Okay, probably not. Probably not. Subconjunctival hemorrhage, it means that there is bleeding under the skin of the eye. So parang nagkapasa. Pero
Okay.
kita mo siya, red siya kasi clear yung skin mo. AMD is in the back part of the eyeball.
Okay, so it's not related. But Doc, siguro a related question to that is, what would cause me to have that kind of hemorrhage?
Maraming pwede, no? Yung iba kapag nagkaroon pag nakamot ng mahigpit, or pag nagkaroon ng exertion, minsan may history yung iba na nagbuhat ng mabigat, or napaubo ng malakas, no? Hypertensives also are more prone to develop this. But there are still a lot of patients who get it walang known reason talaga. Just like any pasak, no? Just like any bruise, this will go away on its own. Basta na-examine natin na walang ibang problem sa mata, kung subconjunctival hemorrhage lang, it's okay. It will resolve on its own.
Okay, so that's good to hear, Doc. At least, again, they have an option. They don't necessarily need to panic right away. And then, Doc, itong third question naman, kung may katarata ba ang pasyente at may AMD din siya, kailangan pa ba ipatanggal yung katarata?
In my opinion, yes. Oo. Kasi pag may EMD ka, medyo mahina na yung mata mo eh. And kung may cataract ka, that adds to the cost of the blurring of vision. So, kung ang paningin mo, ang labo ng mata mo will be caused by two things, your cataract and your AMD. Kung tatanggalin mo yung catarata, mas lilinaw yung mata mo, although it may not go back to perfect because you still have the AMD.
Okay, so at least thinking about that particular question, Doc, kung alam mo na may AMD ka and it does affect your vision, for you to allow something else to worsen it, para kapag hindi siya nakakatulong. And for your doctor then, mahirap i-figure out kung ano ba talaga yung worsening ba? Is it really due to the AMD? Or yung katarata ba na taon lang na kumapal siya? So, kumbaga wini-weigh mo rin dapat. And it's good that at least this patient is aware na the cataract does in fact affect yung vision. So, yan, ipa-check natin. And if possible na tanggalin, then might as well tanggalin.
That's
And then,
right.
Doc, here, lahat ba ay pwedeng magka-AMD?
Lahat ba pwede magka-AMD? Theoretically, yes. No? Yung iba nga sasabi sa studies pag 90 years old and above ka, the risk is parang up to 45%. No? Kasi nga, sakit talaga siya ng pag-iedad. Pero hindi naman lahat ng AMD very severe. No? There are a lot of patients with AMD kapag mild lang, they still have good vision. Although we're seeing signs already na they already have the yellow deposits, nagkakaroon na ng change ng color, luminipis na yung retina. But as long as you take the vitamins and lalo na for dry type, no, you take the vitamins and you ensure you have you wear the proper glasses and you have your regular checkups, you're okay.
Mm. Ito, doctor, sa follow-up question. So, if you have cataract and at the same time you have a macular condition, what will you prioritize to treat first?
Yeah, that's a good question. Sige. So, I guess it will depend, no? How, ano yung macular condition no? And how active it is. So, if it is active, let's say it's a wet type, no? And wet AMD siya, tapos may bleeding and swelling pa. I would advise to treat the macular degeneration first. No? Kapag mas nag-quiet na yung macular degeneration, saka natin tanggalin yung cataract.
Okay, so again, it depends. Get checked first para the doctor can recommend what to do.
That's right. But if it's the dry type naman, na mukhang stable naman, we can go ahead with cataract surgery. So it's really a case-to-case basis.
Okay. And then here, Doc, this is an interesting question. Doc, I'm sure, ba't kaya minsan yung right eye ko, minsan may part sa ilalim ng mata ko na kumikirot at parang mahapdi. At yung floaters, nagre-remain pa rin po.
Okay. So, parang madaming concerns. Isa-isahin ko lang. So, meron siyang mahapdi sa kumikirot. Okay, so yung mahapdi and kumikirot, that's not related to AMD. That can be related to something else like dryness, no, or eye strain. It may be best to try lubricants for that. Yung floaters naman, ang floaters naman, aging din yan sa mata. But hindi naman siya sa retina, no? It's in the gel, in the middle part of the eye. Ang kailangan sa floaters is ma-check them kasi minsan sign din siya of a retina problem, like a retinal tear or a retinal detachment. So, importante na ma-check yung floaters para masiguro hindi siya delikado. Pag nakita naman na hindi siya delikado, most of the time, the floaters will remain inside the eye. No? Kasi kasama lang, ganun lang talaga ang floaters. We do not do surgery for floaters unless kailangan, no? Unless may iba pa siyang sakit. Pero kung floaters lang, binabantayan lang namin yan just to be sure na wala siyang associated retinal tear or retinal detachment.
Okay. And then ito naman, Doc. Ang adult acquired nystagmus, is it part of AMD?
Most of the time, hindi. Theoretically, pwede. With poor vision, pwedeng magkaroon ng inability to focus. No? Yun yung pwedeng mag-cause na mag-wiggle yung mata. Pero it's not usually associated with AMD.
Okay. So it's likely related to a different condition that has to be treated separately.
Yes.
And then, Doc, will the application of artificial teardrops help?
For AMD, no, it will not. No, but artificial tears will definitely help to relieve you of the dry eye symptoms like mahapde, nagluluha, or yung dry, or sometimes may blurry vision, tapos pag pumikit ka, nag-i-improve siya ulit. So those are signs of dry eye, and that is where artificial tears or artificial eye drops will help.
So siguro lalo na for a lot of us that are working at home, or let's say you've been on your computer for a few hours, it could just be help na to use some eye drops to help relieve yung dryness. Kasi kapag nag-work on a computer, may pinapanood ka na medyo matagal, nagda-dry talaga yung mata.
Yes.
Kasi you forget to blink.
That's right. No? So lalo na itong nag-pandemic tayo, everyone's confined, everyone's just using their computers and watching. So it can really take a toll on your eyes, no, and it can cause dryness. So that is where artificial tears can help. And aside from artificial tears, kailangan you really have to take breaks. No? Hindi pwedeng marathon na 8 hours ka na manonood or magko-computer. Imagine kung naglalakad ka ng 8 hours, hindi ka ba mapapagod? Ganun din yung eyes mo. So you really have to take breaks kung kailangan mo talagang mag-work na 8 hours.
Okay. And then, Doc, ito, which is better to diagnose AMD, OCT, or fluorescent angiography?
Okay. So, better to diagnose, sa ngayon, ang diagnosis ng macular degeneration is by clinical pa din, but this is aided by OCT and fluorescein angiography. Fluorescein angiography ngayon with technological advancements are able to detect AMD na din with high sensitivity. Ibig sabihin nun, kaya na niyang ma-detect yung mas mataas na yung chance na accuracy natin ma-detect yung AMD using the OCT compared sa fluorescein angiography. So, compared sa clinical exam. Yung fluorescein angiography, yan talaga yung ginagamit natin. Pero, there are a lot who are not using it as much as before kasi naging maganda na yung OCT natin. No? Naging maganda na yung OCT natin and it has been very helpful in confirming kung meron ng macular degeneration. Pero, I can't say specifically na, OCT is better than FA kasi it will still depend on the case. There are cases na it's still fluorescein angiography that will be able to detect it better.
So I guess in a lot of cases, you don't necessarily have to choose one over the other. Minsan, it's a combination. And it also depends on the type of technology kasi being used in, let's say, with the doctor that you're consulting. So, instead of, at this point, ikaw yung nag-iisip, it's better to actually talk to your doctor because they will try to recommend what would be best for you. And then ito, Doc, the next question naman, pag ba may AMD at nagpa-opera ang katarata, magsasalamin pa ba?
Magsasalamin pa ba? Okay. So meron kang AMD and cataract, no? So, nagpo-opera ka na ng cataract. So, the question is kung magsasalamin ka pa. Chances are yes. Chances are yes. Kasi, baka, ang magiging salamin mo will be for reading. Malaki yung chance. Ang salamin mo will aid you for reading. Pagka gagamit ka ng reading glasses. Kung advanced yung AMD mo, pwede rin gumamit ka pa ng ibang low vision aids, no? And that includes glasses as well. Kung lalo na hirap ka with specific tasks.
And siguro, Doc, it also depends on what type of lens you choose kapag nagpa-cataract surgery ka.
That's right. So, that's a good point you raised, no, Audrey, kasi there are different types of lenses we use in cataract surgery. So, meron tayong monofocal. Monofocal will give you good vision for distance. So, ang target nun, hindi ka na magsasalamin pag sa malayo, pero zero siya. Zero siya for reading. So, you'll have to wear glasses pag magbabasa ka. Meron din tayong multifocal. Yung multifocal, may grado na siya, yung lens implant, may grado na siya both for distance, computer, and reading. So, most of the time, you will not need to wear reading glasses anymore. Pero, itong multifocal lens, this is not recommended for patients with macular degeneration. So, we will be left with monofocal, no? Kasi sa mga pag-aaral, patients, if patient with AMD receives a multifocal lens, hindi siya happy with the vision that he or she obtains. So, it's still best to use a monofocal, and you will need to wear glasses for reading.
Okay, so again, it depends on their eye condition talaga. I
Yeah.
think, Doc, there's one that's a follow-up question. Ask ko lang po, Doc, minsan nakakaranas po ako ng pain both in the side of my eyes. Apektado po yung ulo ko, parang stress yung feeling. Di kaya nagkakaroon ako ng retinal migraine.
Okay, sige. So, pain in the both sides of the eye, no? Saka parang may stress, no? Pwede rin. Yung ocular migraine or retinal migraine, ang kadalasang description sa kanya, ito yung may nakikitang jagged lines. No? Parang jagged lines yan na parang fixed siya na mo maintindihan na parang merong sparks na parang may ilaw, no, na may jagged lines siya. So, kung may ganun ka, you may be experiencing that type of migraine. Pero kung no, and that type of migraine, pwedeng magkaroon din ng headaches.
Mhm.
So, kung may ganun, it's best na mapacheck din kasi hindi rin lahat migraine lang siya. Parang pwede rin yung pag may nakikita kang mga ganung lines, pwede rin sign siya of flashes na baka meron na palang problema sa retina. So yung ang mas sinasuggest natin for that is to have an eye check. Also, if you have eye pain and headaches, baka meron pa ding grado na hindi nakakorrect with glasses. So makikita rin yun. And pag nagawa yung comprehensive eye exam, from the vision check, makita from front to back, you'll be able to get all the information and come up with your diagnosis and a treatment plan to help you.
Okay. And then, Doc, there's another question from Matthew. What is the medicine for CRVO?
All right, CRVO. CRVO for everyone, no, is a central retinal vein occlusion. So nagkakaroon ng stroke, no, sa central retinal vein, isa sa mga blood vessels natin sa retina. Ang nagiging effect nun, so mas nakita natin to sa patients na may hypertension. And yun, no, kasi nagbabara yung ugat. Just like nagkaka-stroke ka sa brain or na-atake ka sa puso, may nagbabara ng ugat. Ganun na nangyari sa central retinal vein occlusion. Ang gamutan dito, as usually, nagbibigay tayo ng injections din, anti-VEGF, for the complications of CRVO. Pag nagkaroon ng maga in the macula. So, macular edema naman ang babatayan natin for for CRVO, no? And kailangan ding bantayan for glaucoma kasi pwede rin maging complication siya at pwede rin magkaroon ng iba pang bleeding kapag malaki talaga yung naging damage from the CRVO. So, it will depend on the condition, kung ano yung meron, yun din yung mga gamot na pwede natin bigyan.
Okay, so check up din, Doc.
Check up muna. Oo, kailangan check up muna.
Okay, so Doc, I think that is actually our last question for today. So let's say some of our viewers for today actually want to get their eyes checked with you. Where can they set an appointment?
I have clinic in Trinoma every Monday, Rockwell every Wednesday and Friday, and in Alabang, Commerce Center in Alabang every Saturday.
Okay, so thank you so much for spending the afternoon with us, Doc. We know that it's a holiday tomorrow, so you'll actually still have clinic, I think, for in the satellite clinics. But so anyone that wants to set an appointment, they can just call us up, send us a message through Facebook, or even send us an email. So thank you, Doc. Thank you so much for spending the afternoon with us. We learned a lot about AMD.
Thank you, Audrey. Thank you for helping me share my knowledge with everyone.
Thank you, Doc. Have a good weekend.
Okay, have a good weekend.
For everyone else naman, please know that all Asian Eye clinics are open to serve you if you want to try Asian Eye Tele. So again, Doc mentioned that sometimes meron kang eye redness or irritation that you want to consult and you want to talk to your doctor. You can do so through a video call. You can just schedule an appointment by calling our teleconsultation hotlines. You can also avail for EGC at www.asianeyeshop.com for only 400 pesos. So again, hindi ka sure, meron kang konting irritation, might as well get it checked. Use the GC. It's gonna be cheaper for you to get the teleconsultation done para you have a little bit of peace of mind. And speaking of the Asian Eye shops, you can also stock up on your eye medication and have it delivered straight to your home. So let's say, as the doctor recommended, minsan meron kang dryness in your eye, lubricants are a good option for that. And you can get them online through the Asian Eye shop. You can also get glasses, your contact lenses, and be guided by the optometrist. Hindi basta-bastang bibili ka lang. You also get some personalized assistance. And you can also enjoy certain promotions. So one is that you have free shipping for purchases over 1,700 pesos. That's nationwide. We also have a free upgrade to UV plus blue light lenses when you purchase daily specs or kid specs frames. So whether ang salamin ay para sa inyo or para sa anak nyo, free na po yung upgrade na yun. We also have buy one, take one on active spec sunglasses. So exactly for the people who are thinking about going on vacation for this summer, it's good to take care of your vision by protecting your eyes from UV rays. And of course, if you need to get your eyes checked at our clinics, you may also book an appointment via the numbers flashed on the screen. Email us at ihelp@asianeyeinstitute.com or message us through our Facebook, Twitter, or Instagram accounts. Once again, thank you so much for joining us today. Please continue to stay safe and see you on our next Asian Eye Doctor Ask Your Asian Eye Doctor Facebook Live Q&A. Stay safe.